name is Dr. PGM Adam Rafi. Today we are going to discuss about cholinomimetics. Okay, before going to the topics, first we need to know about acetylcholine biosynthesis. How acetylcholine is synthesized? Acetylcholine will be synthesized in the neuron with the help of acetylcholine enzyme A plus choline. In the presence of choline acetyl transferase, it will form acetylcholine. When this acetylcholine is formed, it will taken up by vesicular associated transporter from the cytoplasm to the cell. After taken up into the acetylcholine, when the nerve get depolarization, the calcium ions will get entered. So once they enter into this neuron, they will cause releasing of acetylcholine into the synapse. So once this acetylcholine will be released into the synapse, it will go and bind to the cholinereceptors, whether it may be nicotinic receptor or muscarinic receptor. The duration of action of acetylcholine is 30 to 90 seconds. So within this time duration, it will be degraded by enzyme, that is acetylcholine esterase enzyme. With this help of acetylcholine esterase, acetylcholine is degraded into choline and acetate. This both will be taken up into the neuronal for further biosynthesis. Next we will see. So now coming to the topic, cholinomimetics. Cholinomimetic means drugs which mimics the action of acetylcholine at muscarinic and nicotinic receptors. They will be acted by two mechanisms, whether they will act directly and indirectly. Directly means they will go and bind to the receptor and activate it. Example like M1 receptor, they will go directly bind it and enhance gastric secretion. They will go bind to the M2 receptor and decrease cardiac activity, like that. Okay. Indirectly means, previous slide. So in the previous slide, we will see there will be an enzyme, that is acetylcholine esterase. By inhibiting this acetylcholine esterase enzyme, obviously there will be elevation of acetylcholine in the synapse for the long time. So there will be more action will be produced. There will be two types. One is reversible, another one is irreversible. Reversible examples will be physostigmine, edroponium, neostigmine, pyridostigmine. In irreversible, why it is irreversible means they will form covalent bonds with the receptor. So obviously it will become irreversible. So examples of that one is organophosphates. For that examples, parathione, malathione, ecothiophyte. In carbamates we will have propoxur. Next, what are the therapeutic uses of cholinomimetic drugs? These drugs can be useful in reverse post-operative and postpartum atony of bladder. So what are those cholinomimetic drugs helpful will be here? Methacholine and carbacal. Samely, post-operative intestinal spasm, it is useful. Samely in glaucoma. Then reversal of atropine-induced mydriasis. Why means atropine will causes mydriasis. When we give cholinomimetic drugs like pilocarpine, it will act on circular muscles and it will causes constriction. Same time, iridocyclitis is also beneficial. Xerostomia, it will act on glandular, means M3 receptor, thereby xerostomia is there will be no secretions. So dry eyes. So we will give enhanced glandular secretion, there will be more lacrimation, there will be more glandular enhancement of secretion will be there. So what are the contraindications? Which condition is contraindicated by using cholinomimetic drugs? So those situations will be bronchial asthma. Why means bronchial asthma will be, it is a constriction, hyper responsiveness of smooth muscles. So when you give cholinomimetic drugs like methacholine, carbacal, all these things, what will happen? This will enhance further more contraction. So it will be absolutely contraindicated. Peptic ulcer is an abnormal condition where obviously there will be more rise in gastric acid secretion. So to prevent that one, so to avoid that, we should avoid cholinomimetic drugs. Samely, myocardial infarction, obviously it is contraindicated because it furthermore decreases the cardiac activity. Thank you.